everyone. This is Ellen Taverna from the ARC of Massachusetts. Today we are doing our Friday federal COVID-19 updates. And we have a special guest with us from the ARC of United States. That's Bethany Lilly. Thanks so much for joining us, Bethany. So I know that many of you are familiar with the ARC. We are an umbrella organization with 17 chapter affiliates, and we work with provider, government, and advocacy agencies. And the mission of the ARC of Massachusetts is to enhance the lives of people with intellectual and developmental disabilities, including autism and their families. And we are the state chapter. We're also a member of the national chapter, which is the ARC of the United States. So for today, we have a special treat that we have Bethany Lilly with us, and she's going to give some updates on the federal COVID-19 relief packages. And then we'll do, after her presentation, we'll do some questions with Bethany. And then I just have a few things to add at the end about the We Are Essential campaign, and then some other federal and Massachusetts policy updates. And then we'll have some time for questions at the end as well. So thank you so much, Bethany, for joining us. Bethany is the Director of Income Policy at the ARC of the United States. And I'll leave it to you, Bethany.
Great. Thank you, Ellen, and it's wonderful to be with all of you today. I'm very excited. I have been buried in a lot of work with Capitol Hill and all by myself in my house, so it's always nice to have a chance to actually talk to people every day, which I'm sure a lot of you can sympathize with. So with the ARC of the US, I handle a whole collection of different policy issues, but primarily my main focus is Social Security and SSI and income support programs. I also handle kind of means-tested programs like SNAP and other types of programs that help support people that generally have some kind of means testing component. I also handle ABLE accounts, so if you have questions about that, I can answer them, but otherwise, I may have to send you to one of my colleagues to answer some other questions. But what I was asked to talk about today relates to the third COVID relief package and what Congress passed right at the end of March, and how that has been working out for people with disabilities. So the first and kind of biggest piece in the third COVID package was stimulus payments. So a flat check that goes out to most Americans, and there are some exclusions to that, and we'll get into that in a little bit, but this stimulus check is, you're eligible for it if you have a Social Security number, if you are not claimed as a dependent on someone else's taxes. And so that can be a little bit complicated to know yourself, but I will say that the Treasury Department has a list of everyone's Social Security numbers, and they know if you've been claimed on someone else's taxes. And so they should be able to figure that out automatically. Parents can claim an additional $500 credit for dependent children, so long as the children are under the age of 17. So they have to be 16 or younger. And if you live in a family that has kind of a mixed immigration status, this gets a little bit complicated, and some people are excluded depending on how you file taxes. If you have questions about that, I can certainly send you some resources. I'm afraid that I'm not an expert in kind of that particular piece of this, but I do know some folks who are, so if you have questions, I can give you some resources there. Next slide. So how much is the payment? The payment is $1,200 for individuals and $2,400 for married couples. It does phase out over certain incomes. So if you make more than $75,000 a year, you may not get the full payment, and that taps out. It's reduced by 5%. So it basically, if you're an individual, you won't get a payment if you make more than $99,000 a year. If you're an individual or a married couple, the payment will start phasing out at $150,000, and that taps out at about $198,000. So just so you know, there is kind of an income limit at how much you can make and you won't get the payment otherwise. Next slide, there we go. And I think probably the most common question I get from folks is whether or not income or asset limits apply to these payments. And I would want to know the answer to that too. Luckily, the answer is very, very straightforward. No, they do not. Because this payment is structured like a tax rebate, even though you don't have to have filed taxes in order to get it, it's effectively completely excluded from your income. And because of the way that certain other tax credits are treated, this is treated the same way, and it won't count as an asset for 12 months. So you have 12 months to spend down the money however you would choose to spend it. And this means that a lot of people with disabilities who rely on Social Security or Social Security disability or disabled adult child benefits, or who get SSI or SNAP, don't have to worry about losing their benefits if they get this payment. Which is really nice to know, because I would be very worried about that. I will also add, it's not on the slide, but Medicaid won't be a problem either. That's another program that just won't take this payment into account. So how are you going to get the payments? Well, I have big news on that. On Wednesday, the Social Security Administration and the Treasury Department announced that everyone would automatically get their payments if they receive Social Security payments or if they receive SSI. We had been arguing and working with the Treasury Department and with Congress to try and come up with a fix to make sure that people on SSI would get their payments automatically. And we succeeded on Wednesday, and I am very excited about that. I know that it's a huge burden, especially right now, to try and figure out how to get these payments and how to file your taxes if you need to file them, you know, how to fill out whatever forms the government is issuing. And I will be honest that because they're rolling this out so quickly, the government has not had very clear messaging on this. So I can just safely say right now, you don't have to worry about it if you get an SSI, you will just get your payment automatically. So how will you get your payment automatically? It will go into whatever, it will do the same process that your SSI check usually does. So if you get it on a Direct Express card, you'll get it on a Direct Express card. If you get it sent to your rep payee, then it'll be sent to your rep payee. So don't worry that it'll just be handled exactly like your SSI check. We are very relieved to see this. We think it'll make everything a lot easier. The one exception is if you are on SSI and you have a child who is under the age of 17. If you want to claim the $500 child credit for that individual, you do need to fill out a form. You can go to the IRS website and fill out the form there. I will just caution you right now that the IRS website has not been updated to reflect the new information. So you can fill out the form, but it will say other things, and you can just ignore the other things that the IRS website says. You only need to fill out the form if you are trying to claim dependent children. We also aren't clear entirely right now on what's going to happen to some veterans benefits or beneficiaries who have disabilities. There are two programs that kind of help very low income disabled veterans, and those programs were not made automatic. And so one of the pieces of advocacy we're working on with all of our colleagues in the disability community is making sure that those folks are also included, because we don't want to leave anyone behind when it comes to automatic payments. So there are some other areas of advocacy where we still need to focus. And I think that the biggest one, and one that I'm guessing a lot of you may have experienced, is that adults with disabilities who are claimed as dependents aren't currently eligible for these stimulus payments. They also aren't eligible for the $500 credit for dependent children. So we want to make sure that everyone is included. And since this dependent exclusion does disproportionately impact people with disabilities, we have been explaining to Congress how big of a problem this is. We have not yet identified some champions in Congress, and that tends to make these things a lot easier. So we are asking everyone to please contact their members of Congress and ask them to make sure that dependents are included in the next COVID bill, that dependents will get stimulus payments in the next COVID bill. The other major thing that I've been getting a lot of questions about lately is around unemployment insurance. And this is because I think, by and large, that unemployment insurance doesn't usually work for people with disabilities. A lot of people with disabilities work part-time because they're on SSI or SSDI. And because of that, traditional state unemployment programs don't always work. It depends a lot on the state where you live. But there was a big change made in the CARES Act, or the third COVID package, that included some improvements to the UI program and some expansions of UI that make it more likely that people with disabilities may be eligible, including those on SSI and Social Security. So I just wanted to flag that this is a program that people may be able to take advantage of. There are three major policy changes that the CARES Act included. One, it provided UI benefits to part-time and other workers, so it's a much bigger segment of people that are now eligible. It also dramatically increased the amount of the benefits by $600 per week, which is a lot of money. And then expanded the pandemic emergency unemployment compensation. It's a complicated way of saying it just took the traditional state UI program and added an additional 13 weeks to it. So it made it last longer because we're not entirely sure how long we're going to be in this situation with COVID. And so they wanted to make sure that everyone was covered. So the first of these, the PUA program, that is going to cover more people with disabilities because it includes part-time workers. So when you're thinking about applying for unemployment, there are a couple of things you should keep in mind. So UI benefits are counted as unearned income. So if you are on Social Security or SSDI, or which would include SSDI or include disabled adult child benefits, this won't have any impact. Effectively, this is just treated as money that's coming in, but you didn't earn it. So the substantial gainful activity test, which I'm guessing most folks are familiar with, won't apply. So if you're on Social Security, you should be fine. Where it gets a little more complicated is how this impacts SSI beneficiaries, because unearned income offsets the amount of money you get from SSI. So that means that the big $600 bump from the CARES Act may offset your SSI benefits. It depends a little bit on how much you're working and what your usual salary is and how that will be taken into account. But I just want to flag for folks that that is a lot of money and it will offset SSI benefits. There were some concerns around how this would impact Medicaid eligibility, but I just want to say very clearly, the second COVID package protected Medicaid eligibility for everyone currently on Medicaid. So as long as your state is accepting the 6.2% federal matching bump, which Massachusetts is, you don't have to worry about your Medicaid eligibility until the emergency is over. So we have a fact sheet on unemployment because I know people have had a lot of questions, and I'm sure Ellen and Leo can send it out after this, but I just wanted to those are the major issues for folks as you're thinking about it. Just be aware that if you're on SSI, this gets a little more complicated. We also are encouraging Congress to help with some things, or to fix some things about this so that it won't be taken into account for SSI. But unfortunately, we didn't win that negotiation in package 3. So we will continue it in package 4 and maybe we'll win it there. So around paid leave, I also handle paid leave since it's a worker support program, and it also kind of provides income support for workers when they're unable to take time off, or when they need to take time off. So this is a little bit complicated because there are 2 different kinds of paid leave that were included in not the third package, but the second package. There's been a lot happening in Washington, D.C. lately. So there is an expansion to FMLA, and that is for parents, very specifically just parents, who need to take time off to care for children whose school has closed, or if something happens, like a place of care closes. DOL in their final rule, which they published on April 6th, clarified that this included parents of adults with disabilities. So you may have access to paid FMLA leave if your child with a disability has lost their usual source of care, even if they're an adult child. This is important because this FMLA expansion provides 12 weeks of paid leave rather than 2 weeks of paid sick days, which is kind of the other piece that Congress included in the Families First Act. This paid 2 weeks has a much broader range of caregivers. So for instance, a situation that I think about a lot is you could take time off and go take care of a sibling who might need help. You could also take time off and go take care of a cousin who might need help. Unfortunately, the expanded FMLA leave doesn't cover anyone other than parents, so it also won't cover grandparents, and it also won't cover siblings. So unfortunately, it's not as broad as we would like, and that's one of our major concerns going forward is we think that this should include caregivers who might need to have more flexibility. Maybe mom and dad need to stay working, but sister or brother can take time off, or grandma or grandpa could. So we really do think that this needs to be broader. And it also doesn't cover individuals who need to self-isolate. I'm sure all of you know, because Massachusetts is third in the nation right now in terms of the number of COVID cases you guys have. And that's something that, you know, as one of my disabilities is that I have a pretty severe type of asthma, and I am not excited about catching this disease. And so I've been very, very careful about my self-isolation. And I know I'm not the only one. I know there are a whole collection of conditions where people are at particularly high risk here. And so we are asking Congress to expand FMLA to include people with disabilities who need to take the time off and self-isolate and not go back to work. Next slide, there we go. So what is needed moving forward? So I talked about number 3 just now, but the other 2 major priorities we have, and these are really, really important, and Nicole Jarwick at my office has been doing an amazing job of advocating for these on Capitol Hill, is we need funding for a Medicaid grant program to boost HCBS services. That is probably the most important thing we can get right now. I'm sure all of you are experiencing kind of the crisis the HCBS system is in right now, and getting more grant funding for those folks and for everyone across the nation who's relying on DSPs or who needs help with in other ways from the HCBS system, that is crucially important. So that is our big ask. We also know that across the HCBS workforce, we are having major issues with accessing personal protective equipment, or PPE. And so we are trying to get Congress to focus very clearly on getting PPE, expanding access to PPE, but also getting it to the HCBS workforce, because we know that's really important. And part of that is how we define and value the HCBS workforce, and it involves making sure that those workers are also designated as essential. So those are our 3 big asks going forward for the next COVID relief package. Funding for an HCBS grant program, making sure that HCBS workers have PPE, and making sure that paid leave covers all the caregivers and people with disabilities. So that is, I think, my presentation. We'll see what the next slide says.
Yes. Yeah. Thank you so much, Bethany. So I was going to open this up now for questions to you, and then we can talk, we can go over the We Are Essential campaign, which is the next slide I'll show. And then talk about a few other things that are specific for Massachusetts. But does anybody have any questions for Bethany right now?
I have a question.
Okay, go ahead.
I received a check, Bethany, but I think the check is wrong. It is for $2,400, and you mentioned that those are for married couples, but I am a recent widow.
Well,
actually more than a year, but
I'm so sorry.
For $2,400, and I'm not sure what to do. So
You don't have to do anything, because this isn't actually based on this year's taxes. It could be based on 2018 taxes or 2019 taxes.
Oh, okay.
And so I wouldn't worry about that. I would just go ahead and use the money however
In
you
the
want.
bank.
And I'm so sorry about your loss. That's
Thank you.
this didn't help.
Oh, you got a thank you for joining us today by Christine.
As I said, I'm happy to join people. It's nice to connect.
Does anyone else have questions? You can either unmute yourself or you can write it in the chat box. I have a question, Bethany, about, so I just want to make sure that people are aware of that, like the best way, especially around the adults with disabilities who are claimed as dependents issue. Right now, the most important thing people can be doing is reaching out to their members of Congress. Is that right?
Yes, and
Okay.
telling their stories, explaining why it would really be helpful that you as a person with who are a dependent could really use that money in some way, or you as an adult caregiver would really appreciate having this because of all the costs of self-isolation that you've experienced or other things. We are trying to, as I said, this was something we fought about in Congress when it came to passing package number 3. And that makes it a little bit hard because Congress doesn't like to go back and look at things that they already argued about. But we're very hopeful that if we get enough attention and folks are getting stories into offices, we could build up to making it part of the We Are Essential campaign and making sure that we've got a fix for it going forward. But we're just kind of, I think Congress is in a little bit of a weird spot with it. So the more stories we can get, the better we'll be.
Okay. Yeah, and I know, because I know that that's definitely, we're hearing it a lot at the ARC of Massachusetts, and I'm sure that's true across the country. So.
I am hearing it as well.
Yeah.
And I do know that we've already gotten a couple members of Congress interested. I know that if we don't get broad attention to it, I think we're gonna see, Congress is gonna say, we already thought about this and we don't want to address it again.
Right. So we need to get Warren. We need to get Warren on it. Right now.
I will say Senator Warren has written many letters on related to disability, and she is actually one of the people I'm supposed to check in with, or her staff is later today. So
right, that's great. Yeah, Marky as well. They're both great. So I've read a few articles about like delays for on the stimulus checks. Could you talk a bit about that?
Sure. So most of the media has been around the fact that the president wanted his signature on the checks, and so the checks have been delayed. People like Catherine and people like me, I actually got my stimulus check on Tuesday. Those folks have direct deposit, and so if you've filed taxes before and you've gotten direct deposit, you probably already are getting your stimulus check or will get it shortly. The delays have been for folks who need paper checks. And that's if you, for instance, didn't have to give the IRS your bank information because you weren't getting a refund in 2008 or 2009, you don't have to worry about, you will be getting a paper check. So your check has been delayed. Your check is on its way. It just may take a little bit longer. And for folks on SSI and SSDI, it may take a little bit longer for those folks to get checks than for people who had direct deposit information from the IRS or with the IRS. In large part just because they're doing data matching at the IRS and at Social Security, and it's going to take them some time to kind of make sure everything's fit. The timeline I've heard is May for SSI and SSDI folks. But if I get any more information about that, I will let you know. That has nothing to do with whether or not the president wants his signature on the checks. That is just data matching at the agencies taking a little bit more time than we'd like. So, but if you're going to get a paper check, unfortunately, it's been delayed about a week because of decisions the administration made.
Okay. All right. Does anybody else have questions for Bethany? Okay, we'll move on to the next slides, and then we'll have opportunity at the end again to ask questions. But I just wanted to remind everyone about the We Are Essential campaign that the ARC of US has launched, and it's been extremely successful. I mentioned last week there were over 35,000 points of contact from constituents of the ARC of US, and I'm sure there's a lot more since last week. But it's really, it's been incredible, and it's helped so much, and I know that it was a big part of why we had that win with the SSI beneficiaries getting the automatic stimulus payments. So thank you so much for all that have participated in the social media campaign. I just wanted to, remind everyone of that they're preparing weeks of action. So there's different policy themes for each week, and this week was around the Paid Family and Medical Leave Act and making sure that there's paid leave for all caregivers and also individuals with disabilities who are self-isolating, that they can get paid leave as well. So, and then next week is access to medications, supplies, PPE, and then we have a round 2 because we had that great win with SSI. We don't need a week of action for that. So going back to home and community-based services, again, and sharing your stories is so important on social media, and then tagging your members of Congress. Let's see. So I also wanted to remind everyone that we have a really important state advocacy going on as well. And as you know, we have our Thursday calls with Maura, and she's talked a bit about this. We've expanded this action alert that went out yesterday with AFAM, the Advocates for Autism of Massachusetts, and we're asking people to take action to support the direct support workforce that serves individuals with disabilities, including autism. And this is a letter that's asking your state representative and senator to let Governor Baker and the administration know that hazard pay increases should be across all human services. So that includes our DSP workforce as well. And so we're taking that one step further. We also have a template where you can do a letter directly to Governor Baker and then Speaker DeLeo and Senate President Karen Spilka. So those are really important, and thank you so much for those that have already participated. And then we still have open an action alert to Governor Baker to address the concerns of our community regarding the Massachusetts Crisis Standards of Care, which was released on April 7th, and that's still open for everyone to participate. And then I just have a quick update around the census. There are some new dates. So we're doing really great in Massachusetts, although I have to say I looked so that you can, the Census Bureau has a link, and it's up on our census webpage on the ARC of Mass website. And I was comparing to other states, and we're above the national average, but we're below states like Idaho and Illinois and Wisconsin. So I feel like we could be doing a lot better in Massachusetts. But the big part of our message is that there are still hard to count populations in Massachusetts that have lower response rates, and we need continual outreach. And as you know, the disability community is considered hard to count. So we're continuing our advocacy around this. We want to make sure that people are being counted and that we're getting the word out of how important the census is, and that it's easy and that it's safe. But I did want to just highlight that the census dates, the field operations now have been delayed, and they start, or it's supposed to start on June 1st, and then they're extending their census enumeration efforts until October 31st. So we have some more time to get the census right in Massachusetts. And of course, as you guys know, the ARC of Mass is a census questionnaire assistance center. So I just have the contact information up there. So if you have any questions around the census, please contact us and let us know. So that's all I have. If we take a few questions, I have Bethany's contact information and my contact information. But let's see if the chat, if we have any questions. Oh, Maura says there's 500 letters so far on the hazard pay. That's awesome. That's incredible. All right, well, does anybody have any questions, or these are all great comments, thank you. Wonderful work. Yeah, and I have to say, the ARC of US is just been so incredible in their advocacy, and they're so accessible, and getting out all of the important information in a really like simple messaging way for all of us in the states to grab onto. So we really appreciate all the work you're doing in DC, Bethany. Your team is amazing there. So thank you.
Thank you. And I will pass it along because we have a lot of really wonderful people working with me on all of this. And I just want to say thank you to all of you because I know we are in a very strange place. And every single time you reach out to Congress, you make our jobs a little easier, and we really appreciate it. And I know that there are 10 billion things you need to worry about at the state level, including hazard pay. And congratulations on those 500 letters, because that's amazing. Hopefully that should be an easy get. Nothing is easy, but that one makes a lot of sense to me. So good luck, and thank you all. I really appreciate all of your work as well.
All right. Well, thank you, everyone. Have a great Friday and great weekend. Thank you. Bye.
Thank you. Bye.